On today's episode of the Forgiven Nutritionist podcast, I had the pleasure to talk with Dr. Eric Balcavage. He is the owner and founder of Rejuvagen, a functional medicine clinic in Pennsylvania. He's a nationally recognized speaker and educator on various health topics, including thyroid, physiology, biophysiology, detoxification, oxidative stress, and chronic illness. He's a functional medicine practitioner and a licensed chiropractor in Pennsylvania. He is also the host of the Thyroid Answers podcast that focuses on answering the questions those suffering with chronic hypothyroid symptoms that can't get answered elsewhere. Dr. Balcavage has made it his mission to change the way medicine looks at hypothyroidism. He's the co-author of the book, The Thyroid Debacle, which we also talk a little bit about today. Here's a clip from today's show.
The other markers you can take a look at is your fasting glucose, your fasting insulin, and your hemoglobin A1C. If you're fasting glucose, by the way, is like the worst of the markers to take a look at. But even if you're fasting glucose, don't let them just run a fasting glucose. Ask them to run a fasting insulin as well. If you're fasting insulin, and some docs, I like C-peptide, I think it's a better marker, but it's a little bit more expensive, and it's easier to get an allopathic physician, I think, to run a fasting insulin. But if your fasting insulin is above 8 or 10, even if your fasting glucose is normal, you're already headed into glucose or insulin resistance. I don't even like the term insulin resistance because I think insulin gets a bad rap. Insulin's doing its job. It's glucose resistance, which is really going on. The other things you can look at is your GFR, your glomerular filtration rate. And that's an indication of how well your kidneys filter fluids. If you're healthy, you should be in the 100, 120 range for your GFR. If your GFR is under 100, then there's some dysfunction occurring at the renal system, your kidneys.
Hey everyone, just a quick break to show some gratitude to our sponsors and give you some special deals. If you are looking for a trustworthy place to choose all of your supplements, FullScript has 285 different brands to choose from. They did the work for you to check quality standards for all the supplements they carry. These standards are important because they help to ensure a product is safe, effective, and accurately labeled. FullScript uses third-party companies to provide unbiased assurance that certain quality criteria are met when they add a company or product to their inventory. When you set up an account with FullScript, use my link and you'll always get 15% off your supplements. Welcome, Dr. Balcavage. Thank you so much for coming on today. I appreciate it.
Absolutely. I appreciate you inviting me on the podcast.
Today we're going to talk a little bit about your book that you co-authored called The Thyroid Debacle, which I think is a fantastic title, and a lot of questions that we'll be touching on. We'll talk a lot about things that were in your book. But maybe today we want to start with some of the basics, because I think that maybe somebody has just been diagnosed with either hypothyroidism or Hashimoto's, and maybe you have kind of a little bit of a backstory that you could tell my clients as to how you got interested in the thyroid or even being known as the thyroid problems doctor.
Yeah, I really didn't have any intent on getting into thyroid physiology. I originally trained as a chiropractor. Originally, I was going to go to medical school in college. Then I was injured in a car accident, wound up dropping out of school for a while, restarting school, and met a gentleman who was the local chiropractor and wanted me to play rugby for him. And I was like, man, I hurt my back. I can't really run. And he said, hey, if you come see me, I'll fix you, and then you have to play rugby for me. So long story short, I went to see him. He fixed me up. I started playing rugby. And when I was making the decision to go to medical school, he said, why would you want to do that? And I said, well, I want to help people. And he said, I think you should go to chiropractic school. And he looked at, I said, why would I want to do that? And he pulled out my health history and said, well, how's your sinuses? How's your stomach problems? How's this? How's that? How's this? And after 3 years of chiropractic care and playing rugby and working full time and partying like a college kid, somehow my health was better after that time frame. So I was like, all right, well, maybe there's something to this chiropractic thing. I was just going because my back hurt, but I didn't realize all the other stuff got better until he really pointed it out. And so I went off to chiropractic school, did my chiropractic thing, and then when I got out, I was doing chiropractic care, and I got a message from my brother who said, hey, his wife was diagnosed with hypothyroidism, anemia, and fibroids, and essentially the answer for a 28-year-old female, I think is what she was at the time, was let's do a hysterectomy, put you on thyroid medications, and put you on iron. And I said, well, what do you want me to do? It's not what I do. And he said, I know, but you'll figure it out. And so when your brother says that type of stuff, especially your big brother, you figure out, all right, I guess I got to figure out what to do to help her. And so that I started digging back into my roots. And I was a medical technology major in college, so we did blood work. I worked in the lab and before I went off to chiropractic school, so looking at blood work, doing blood work, but I really thought I left that behind. And so as I started digging into labs, I got into functional medicine. I hooked up with Datis Karazian and did all his coursework. And I started, trying to address what was going on with her. And what I realized real quickly was all these things were probably tied together. That she truly was not anemic. It was the result of what was going on, where all her blood was going. Putting her on iron was probably not going to be a great long-term strategy. It seemed odd to me that the solution for fibroids was just to do a hysterectomy on a 28-year-old female. It seems like those organs might be important through life. And then I had realized that, hey, what she was dealing here was an immune inflammatory condition, and maybe we should be looking at that. And her physicians at the time didn't want to hear it. They didn't, what's this goofy guy talking about? And so I wound up providing some guidance for her and helping her through the process. But in the process of helping her and studying and learning all this stuff, I started talking to my chiropractic patients, and I was surprised. I'd never really paid that much attention to how many of them were on thyroid medication. And when I started really talking to them, they were all, a lot of them were not, really feeling better. They were on medication and I guess well managed, but they weren't really feeling better. And so I started talking to them about what I was learning and started helping some of them. And then that just started spiraling, and functional medicine became the biggest piece of my practice. And it became the thing I really enjoyed doing the most. So I wound up primarily doing functional medicine, and that's all I do really at this point in time, is just doing functional medicine. Through all of that training, I learned a lot. I also learned a lot of the stuff that I was learning even as in functional medicine training, which was totally different than what I learned in allopathic training. Some of the things were just not making sense to me. And one of the things was that this immune system becomes dysregulated, loses control, and just starts attacking our gland for no apparent reason. And that just seemed odd to me. And then the more I was looking at blood work and looking at labs, you also see this pattern of people not converting T4 to T3 well. And there was a lot of different opinions as to what to do. We just give T3. The immune system's out of control. And as I just was working with clients and working with patients, I realized what was going on was bigger than the immune system. I didn't think the immune system was really dysregulated. I think it was more of an adaptive change. And that led me to dig deeper and try and kind of figure out what was going on here. And a friend of mine, Dr. Ben Lynch, I was speaking at one of his conferences, and he sent me a paper called The Cell Danger Response by Dr. Robert Navio. And when I read that paper, I realized that much of what we were seeing was an adaptive change. And what we were trying to do, even in functional medicine, was we're assuming that everybody's in homeostasis, and we're giving them nutritional supplementations as if they're in homeostasis, and that if we give it to them, it should work the way we want it to. And when you read Navio's work, you realize that no, the cell physiology operates from one of two modes. It's either in homeostasis, and for the listeners, that's a state of low stress where you make all the energy you need to run all the systems, or we're in a state of allostasis, which is a state of excessive stress. I don't make enough energy to support all the systems, so I have to determine what's the most important thing. So we have a tendency to downregulate metabolism in that situation and ramp up cell defense. And the thermostat at the cellular level is how much thyroid hormone's in the cell. And even though Dr. Navio didn't talk about thyroid physiology in that paper, that was the aha moment for me, that my thoughts and hypothesis that the cellular intelligence, we got here from two individual cells, and that one day that the cellular intelligence just forgot how to work, just didn't make sense to me. And when I read Navio's paper, I realized that, hey, this hypothyroidism that's going on at the cellular level, which continues to create chronic symptoms for people regardless of what thyroid medication they take, was not broken physiology, it was adaptive physiology. And maybe we should stop trying to force the lab values for a thyroid panel lab values into normal range with different types of hormone medication, and instead say, what are the things that are creating excessive cell stress that's causing the cells and tissues to adaptively downregulate their metabolism? And once I made that shift in my mind and started looking at everybody's physiology through that lens of the cell danger response, it totally shifted how I help patients in my practice, and it was a pivotal moment.
Yeah, well, and that's one of the things that I like about functional medicine. No matter whether it's thyroid or if it's depression and anxiety, it definitely sounds like that's helping you get to the root cause of whatever person's issue is. And much like, with depression and anxiety, some people just say, "Oh, it's a chemical imbalance." Well, let's figure out what's causing whatever the chemical imbalance is that you're experiencing. Let's look at the cells. What do you need in those cells, or what do you need in the brain to make those cells work correctly? And when you said how people think that for some reason the body just stops working correctly is a little odd to me as well, and I find it hard to believe that the body just starts attacking itself for no reason. And so I'm glad that there are people like you who like to figure that out and get into the weeds and figure out what's going on.
Yeah, and I think in functional medicine, we started with that premise and that thought process and philosophy. And for good or bad, more people have come into the functional medicine space, some of them from the allopathic community. I think the biggest challenge right now that plagues functional medicine is that we're not guarding the gates in functional medicine. We are allowing people with allopathic mindset, allopathic philosophies to come into the space and just believe that functional medicine is replacing drugs with lots and lots of supplements. And I think that is a problem, because today what I see in my practice is the people who are really struggling, who come to me for help, they've usually been to multiple specialists and everybody who's an expert and everything, and they're on 18 or 12 or 14 different supplement bottles every day, taking 50, 60, 70 capsules a day, and they've been taught that is functional medicine, and that is not. That is greenwashing of medicine. That is not functional medicine, and it's probably not a great strategy for anybody long term. A, it's really expensive, and B, it's still not addressing the root issue. So I am a bit outspoken on that point, because I think what's happened is we're saying we're doing a better job by trying to manipulate values with supplements, but we're truly not addressing the root cause a lot of times.
Mm-hmm. Yeah. There was another doctor that I recently spoke with as well, and she was definitely under the same impression that you are, or followed the same thought mentality, and when I talk with my clients as well, I can only help them so much with things that they're willing to change or do. If somebody comes to you and they're very ill, and for example, they don't want to give up smoking, well, I can only do so much if you want to continue smoking, for example. And all the supplements you want to take are still not going to help you if you continue smoking. So some people have to be definitely ready to do more work and do a lot of steps in a lot of different areas in their life, rather than just taking supplements, because you can't out supplement a bad diet or an unhealthy lifestyle or anything, no matter how many good quality supplements you take.
Listen, I totally agree. It is what I'm saying about the supplements doesn't mean the supplements aren't beneficial. They are very helpful to use as a tool to help someone get better, but they're not the tool. They are a tool. And while everybody likes to promote the whatever the flavor of the month is, that everybody has a mold issue, everybody has a parasite issue, everybody has this issue, and we're always trying and kill something or remove the threat. At the end of the day, if you're what I talk about, Dr. Kelly and I talk about in the book, is the different factors of your health. If you have poor sleep quality, poor respiration, poor diet, poor nutrition, poor mindset, emotional stress, trauma, that's impacting your physiology, it's not sexy, but those are the things that you actually, at the end of the day, those are the things that created this crisis that you have. And you can't out-supplement that. You have to identify what those stressors are and start to improve your level of fitness in all these different categories of your health. And that's, everybody talks about the secret strategy. There is really no secret. If that's the secret, that's the secret, right? You have to improve your health, your diet, your lifestyle. You may need some help to do it, but there is no super secret thyroid support formula that's going to fix you. There is no super supplement like vitamin D that's going to fix you. I mean, if vitamin D was thought to be this thing that was going to cure everybody, it's a $4 billion industry, and people are as sick as they've ever been and as fat as they've ever been. So don't buy into the hype. Foundationally, if you're not willing to change something about your diet and lifestyle, then you're not really trying to do functional medicine. You're just trying to manage different conditions with supplementations.
Right. Well, and like I said, maybe you can kind of go over some of the basics about what hypothyroidism is, what Hashimoto's is, because maybe some people out there are thinking, okay, well, I've got all these symptoms, and what if it is hypothyroidism? Or, they want a name. A lot of times people want a name or a diagnosis. Mm-hmm. And sometimes I think it's helpful because it's a good starting point, but I'm hoping that people will not leave that as their end point and thinking, okay, I'm stuck now. I have Hashimoto's. Now I just have to live with it. So we'll kind of go over some other things, maybe what they can do or what it really is, but maybe you can kind of go over what the Hashimoto's is versus hypothyroidism, what the difference is, what the similarities are.
So when we think about hypothyroidism, you have this gland that sits kind of right in the middle of your neck. It's called your thyroid gland, and it generates this stuff called thyroid hormone. There's two primary thyroid hormones. There's a lot of different thyroid hormone variants, but there's T4 is the primary hormone that's made by the thyroid gland. It's a prohormone. It's not as active. The primary active hormone is something called T3. And the thyroid gland produces primarily T4, a little bit of T3, dumps that into the bloodstream, and that thyroid hormone circulates into the bloodstream. And then when a cell or tissue needs more thyroid hormone to stimulate and regulate the metabolism of a cell, it pulls thyroid hormone in. If it's T3, it goes right to receptors and activates different actions, making proteins and peptides and hormones and all kinds of great stuff in your cell. It helps you run your mitochondria so you can burn food energy and create cellular energy. If you're overweight, it's the thing that helps you burn fat and not store fat. If it's T4 that the cell is bringing in, then that cell converts the T4 to primarily T3, and that increases your metabolism, and that makes you feel good and feel wonderful. When we think about what hypothyroidism is a reduction of thyroid hormone at the cell and tissue level. In true allopathic medicine, traditional medicine, the thought process is that, or the definition is that hypothyroidism occurs when the thyroid gland itself cannot produce sufficient levels of T4 to support the tissues. And if somebody has a gland that's become damaged, dysfunctional, it's been radiated, it's been removed, then they need thyroid hormone replacement. Their gland is not making enough. And if you don't have enough T4 in the bloodstream, then there's probably not going to be enough T4 to get to the tissues. So almost everybody who develops a glandular condition where the gland can't make enough thyroid hormone is going to develop a cellular or tissue thyroid condition, meaning where that thyroid needs to go, there's not enough of it getting into the cells or the tissue, which is really what matters. I talk about cellular or glandular hypothyroidism, which is that there's not enough thyroid hormone at the cells and tissues, and that can occur whether you have a perfectly functioning gland or not. It can occur whether you're on thyroid medication and everybody says the T4 levels are normal and TSH is normal, because the cells and tissues get to determine what happens to the thyroid hormone that's in the bloodstream. They don't have to bring the thyroid hormone in to support the metabolism. We make this assumption that if we just put enough stuff in the bloodstream, it's going to go into the cells and tissues and work the way we want it. But the cells and tissues of the body get to determine what they pull in and what they use. And it's a good thing, because if the cells and tissues didn't have the ability to self-regulate, then every time your metabolism needed to increase, everything would increase at the same time. So let's say you were being chased by the tiger. If you didn't have individual tissue control of what goes on, then when you have to increase your metabolism to run to your muscles, you'd also be pooping at the same time, peeing at the same time, maybe other things going on at the same time that you don't want to have happening. So what the body has the ability to do is to say, hey, we need to run, so let's slow down metabolism, let's shut down the bladder, let's shut down the GI tract so that those systems aren't upregulated at the same time. So it's a really cool system that we can kind of partition energy to the systems and the tissues that need the most, have the greatest need. But if we think about what happens at the cellular state, we have to consider that if I'm a cell and I'm in danger, I don't want to increase the metabolism inside the cell. What the cell will typically do is downregulate the metabolism inside the cell and ramp up its cell defense mechanisms. So I guess a good way for the listener to understand what I mean there is, if I'm a cell and a virus or a bacteria has gotten inside the cell, and the cell senses that there's some threat there, and it wants to try and wall off that cell, wall off that organism, prevent it from replicating, prevent it from spreading. It wants to warn the other cells and tissues that, hey, there's an invader, and it wants to find this thing and kill it. And so what a cell will do is it'll slow down its own metabolism and not manufacture more things inside the cell that could help that organism thrive and replicate. And simple things like that cell is going to downregulate the drive of glucose into the cell. So a cell will become glucose or insulin resistant. Right. And it's a huge problem in the US, right? Glucose and insulin resistance, prediabetes and diabetes. And you might say, well, maybe glucose resistance or insulin resistance or prediabetes is a condition where we just eat too much glucose. Is that really the case? I don't think so. But if somebody's got a threat response going on with their cells, that would be a really good reason why a cell might become glucose or insulin resistant. Why wouldn't it want to bring the glucose in? Because the glucose will support the organism. It can thrive, it can survive, and it can potentially replicate. So the cells are in a mode where if they feel threatened, they stiffen the cell walls, they don't bring micronutrients in as efficiently, they don't make proteins and peptides and all the things that make us feel good, so we feel lousy. And then the other thing those cells will do is they'll ramp up their cell defense mechanisms. So they'll start releasing more inflammatory chemicals and increase the free radicals in the cell to find whatever this thing is and try and kill it. And it'd also be warning the other cells at the same time. Unfortunately, we call that sickness, right? We go, oh, I'm sick, I'm in bad shape, or I feel hypothyroid. Yes, you should expect that if you have some type of infection, some type of threat, that your body is going to downregulate cellular metabolism and create this hypothyroid signs and symptoms. It's also my premise, based on looking at the literature and the research, that when we have this chronic stress response going on in lots of cells and tissues, and these cells and tissues are releasing some of their defense chemicals, these inflammatory chemicals, to go out into the bloodstream to warn the other cells and tissues, those same chemicals can bind to receptors on somebody's thyroid gland and initiate something we call thyroiditis, which is inflammation of the thyroid gland. And that is what typically creates most of the damage or destruction of the gland that leads to primary, or what I call glandular hypothyroidism. Now, some people would say that's an immune system that's out of control. I don't believe it's an immune system out of control, because if you believe that, then you're doomed. But if you believe it's a more of an adaptive response, then it makes sense. If I'm a cell and I'm feeling threatened, I'll downregulate the metabolism locally and deal with the threat. But if it's becoming more of a systemic inflammation, a systemic threat, a systemic infection, what's the best way to downregulate the metabolism in the body? It's to shut down the gland. And maybe that's why the thyroid gland has what we call pattern recognition receptors that are receptive to all of these danger particles. And then those cells in the thyroid gland are the things that actually invite what we call the infiltrating lymphocytes to come in and create most of the damage. And so that's what triggers it. Now, when you ask about what's the difference between primary hypothyroidism and Hashimoto's thyroiditis and thyroiditis, thyroiditis and Hashimoto's thyroiditis are really nothing different. So thyroiditis is the inflammation of the thyroid gland, typically driven by our T cells of our immune system. And if you paid any attention in the last 3 years when we had some crazy thing called COVID going on, you learned about T cells and B cells. They're types of white blood cells called lymphocytes. But when the lymphocytes come in and start creating damage to the gland, that's thyroiditis. When we see antibodies in somebody's bloodstream to some of that thyroid tissue, we call it Hashimoto's thyroiditis, because the assumption early on was that these antibodies created by the immune cells were actually like little Pac-Men eating away at the thyroid gland indiscriminately. Now, that doesn't really happen. The literature says that the thyroglobulin antibodies, which are often tested, don't cause any damage to the thyroid gland, and that the TPO antibodies that they use to kind of identify whether it's Hashimoto's or just thyroiditis create very little damage to the thyroid gland. So I don't think it really makes a difference. If you have thyroiditis going on, if you have glandular destruction, it's one of a couple causes. One, it's your immune system coming in there. It's probably your T lymphocytes. You may or may not have antibodies at the time you're tested, but you have an immune-driven disorder. You could have your thyroid gland removed because there was some damage, and therefore you don't have a gland to create hormone. Or three, you have an iodine deficiency, which could be resulting in decreased production and swelling of the thyroid gland. In most developed countries, iodine deficiency is thought to be less of an issue, and it's thought that this immune-driven process is the primary cause. In maybe less developed countries, especially areas that are landlocked areas where there's not much exposure to salt water and iodine, it's thought that maybe it could be an iodine deficiency. But we have a whole camp, two big camps in functional medicine. One says everybody's thyroid is iodine deficient, and the other camp says everybody's iodine overloaded. So I think it's probably, the reality is somewhere in between there.
I think if it's overloaded, it's probably because of the processed foods and other things that maybe people are eating, those that maybe don't follow what they probably should be doing to assist their thyroid and anything else in their body with healing. Because like you said, when you were talking about how it's protecting itself, so it shuts down some of the functions that it's supposed to be doing. Our body is really always just trying to keep us alive and to fix itself when it needs to fix itself. And so, but it can only do and fix those things when we give it certain things or assist it. And sometimes the thyroid can even get stuck. I know with trauma, for example, even if you're doing the right things and you're eating the right things, you're taking the right supplements to go along with all the other things that you're doing in your lifestyle, the thyroid kind of gets stuck and it needs help to get back onto track to start working properly again. Maybe you could talk about some of those things too.
Yeah, I guess I think we come to some degree. We have to kind of think about the languaging that we're using. Is the thyroid gland itself stuck? I don't know that it's stuck, but if there's a trauma, like an emotional stressor, that's a threat. That's going to create a threat. And I still think, at least at the onset, what we see is not stuck physiology or broken physiology, but adaptive physiology. Yeah. The analogy I often use for people is that, do you have children?
I do, yes.
Okay, so let's say that you're having a big party this weekend, right? You've got a whole bunch of people coming over. You're cooking food, you're cleaning, you're vacuuming, you're doing wash. You got all 4 burners on. You're feeding one of your kids at your kitchen island, and somebody breaks into your home and starts attacking your child. Mm-hmm. Are you going to continue to cook?
No, definitely not.
Okay. Are you going to take the time to turn off the burners and put everything in nice glass Tupperware containers?
No, definitely not. No.
Okay. Are you going to take a nap?
No, definitely not going to do that either.
Are you going to try and finish the wash, finish vacuuming before you go help your kid?
No, definitely not.
All right. You going to go have sex?
No, definitely not going to do that either.
Okay. So if I walked into your home, right, I could see the food burning on the stove, the wash is all laying out over the place, the vacuum cleaner's in the middle of the floor running, the house is a mess, and I can make an assumption that you're just a terrible housekeeper and a terrible cook and a terrible spouse, partner, whatever. Or I can ask a better question, which is, hey, this is abnormal. Now I need to find out why would you abandon all of these things that are going on? Mm-hmm. And that's how I think we should look at our physiology. We shouldn't look at the thyroid physiology and say, oh, it's probably just broken, like it doesn't work. We should say, why are we seeing this adaptive change? If we see a bunch of inflammation in the system, we shouldn't say, oh, you have an inflammatory condition, let's give you something to suppress your inflammation. We should ask, why would the body adaptively increase the immune inflammatory response? What is it trying to protect itself from? Yeah. If your cholesterol's high in your bloodstream, we should ask a better question. Why is the body not bringing cholesterol into the liver to get rid of it? Why is it not bringing it into the adrenal gland to make cortisol, right? We have to ask better questions. And when you ask better questions, like, oh, this person's got glucose resistance or insulin resistance, what is their diet? Oh, they eat a low-carb, high-protein, moderate-fat diet. This is not a person who eats a lot of carbohydrates, so why would they be glucose resistant? Is this because they eat way too much carbohydrates and don't exercise, or is there something else going on here? And when we come at somebody's health from that perspective, I think it changes how we try to help them. And so I think that's the way we should look at it. We need to consider that what we see, at least at the onset, is not broken, but adaptive physiology. Now, if you stay in adaptive physiology for an extended period of time, things will break down for sure. And we call that disease and pathology, but there's a long haul between adaptive change in physiology, malfunction, dysfunction, dis-ease, and then disease. But we're looking at the disease oftentimes as the beginning process, and we're missing that, hey, the body had to adapt to something early on, right? So like if I came into your home, if I ask the right questions and say, hey, something else is going on here, I may go down to your basement and go, oh, well, this makes sense now. She's down here fighting off an attacker to try and protect her and her child. This makes perfectly good sense. Now, let's help get rid of the attacker. And then we can start to restore physiology. But there's one more piece to that. Even though that immediate stressor went away and we dealt with it, it doesn't mean the physiology goes back to optimal right away. Right. You would not go back to, hey, everything is great immediately. Maybe not for days, maybe not for weeks, maybe not for months. And you would probably still be living in that stress response. So it's not as simple as, oh, let me just kill an organism. We not only need to kill the organism, but we have to address some of the other threats to really lower the stressors, and then really support the recovery. And that can take a little bit more time. Yeah,
I'm definitely glad you said that, because I think that people, and I'm guilty of this as well. I mean, who isn't? We all want an immediate fix, and I unfortunately think that's why the old adage, a pill for every ill, has taken hold with a lot of people, because they think that the one pill is going to help them, and it's because it's going to give the quick fix that they're looking for. But sometimes, like you said, things take time, especially when there's something else that once you get to the root cause, especially if it's trauma, it can take years sometimes. And as long as you are faithful and diligent, it eventually will heal. Because again, like I said before, your body definitely wants to work with you and wants you to get better, and it wants to heal, and it wants to get back to, like you said, that homeostasis place. When I talk with my clients about that, I always think to try to explain to them, it's the good plateau that you want to be on. You don't want to be up here. You don't want to be down here. You want to be right there, and always stay close to that middle line right there. And that's where your body always tries to get you back to, but we sometimes need to help it a little bit. Thanks for hanging out with me today. But guess what? The fun isn't over. We've got so much more to share, so don't go far. Tune in next week for the second half. Are you looking for a good probiotic? Seed DS1 Daily Synbiotic has both prebiotic and probiotic. It supports digestive health, heart health, skin health, and gut health, including those who suffer with IBS. Their products are clinically studied and third-party tested for quality, and I think you'll be impressed with their eco-friendly packaging. Click the link in the show notes and use my code FORGIVEN for 15% off your first month supply. If you want to continue learning and hearing all things nutrition for your mind, body, and spirit, click like, subscribe, or favorite me on whatever podcast platform you use. Or you can find me at ForgivenNutritionist.com. This podcast was designed to educate, inspire, and empower you to achieve your health and wellness goals with your current healthcare provider. It is not meant to diagnose or treat any illness or medical condition or take the place of any treatments from your current healthcare providers.